And now it's time to recognize the 2018 Duke University Master of Science in Global Health graduates.
Good morning. It is my distinct pleasure to present the Global Health class of 2018. Please hold your applause until all students have been recognized. Marwa Ali. Marwa conducted a mixed method study exploring disease knowledge and readiness for transition in adolescents with sickle cell disease in Jamaica. Her mentor was Charmaine Royal. Arun Augustine. Arun conducted a pilot randomized evaluation to estimate the impact of screening and referral service on contraceptive use in Bungoma County, Kenya. His mentor was Eric Green. Shashika Bandara. Shash studied the barriers and opportunities of priority review voucher policies to increase access to voucher-winning medicines. His mentor was Jeff Moe. Blaine Mengesha Beru. Blaine explored the characteristics of effective caregivers as perceived by directors of institutions for orphaned and vulnerable children in Ethiopia. Her mentor was Regine Precho-Bell. Laura Borkenhagen. Laura conducted surveillance for swine respiratory and diarrheal pathogens at the human-animal interface in Sarawak, Malaysia. Her mentor was Greg Gray. Payal Chakraborty. Payal conducted a prospective hospital-based cohort study to characterize epilepsy treatment and patient outcomes in Uganda. Her mentor was Mike Hagland. Lillian Chumba. Lillian studied factors affecting implementation of the Option B+ protocol for prevention of mother-to-child transmission of HIV in Kilimanjaro, Tanzania. Her mentor was Melissa Watt. Benjamin Cobb. Ben studied the perceived facilitators and barriers to implementing a technology-supported primary care program for the management of type 2 diabetes and kidney disease in India. His mentor was Tazeen Jafar. Tessa Concepcion. Tessa investigated the burden of pediatric surgical disease in Somaliland. Her mentors were Henry Rice and Emily Smith. Shannon Elliott. Shannon examined partner characteristics and antiretroviral adherence among South African women who have experienced sexual trauma. Her mentor was Kathy Sikkema. Jane Fieldhouse. Jane conducted surveillance for respiratory viruses among patients hospitalized with pneumonia in Sarawak, Malaysia. Her mentor was Greg Gray. Ashley Christina Gibbs. Ashley studied urban water, sanitation, and hygiene access, and the presence of E. coli in the urinary tracts of women in Ahmedabad, India. Her mentor was Mark Deschutes. Clay Jones. Clay examined trends in birth location and birth attendance among women in the Amaracari Communal Reserve in Peru. His mentor was Bill Pan. Naomi Kadima. Naomi studied the impact of a formal breastfeeding education program on the acceptance of and attitudes towards exclusive breastfeeding in rural Haiti. Her mentor was David Walmer. Yishuan Lee. Yishuan completed an outcome evaluation of LifeNet Partograph training in Masaka, Uganda. Her mentor was Joe Egger. Margaret Lilly. Margaret examined the use of mid-upper arm circumference as a nutrition indicator in adolescents in Tanzania. Her mentor was Joy Noel Baumgartner. Delaney Logan. Delaney studied the resource needs, availability, and use amongst children with Down syndrome and their caregivers in Gal, Sri Lanka. Her mentors were Truls Osby and Regine Precho-Bell. Rita Masese. Rita studied the challenges and facilitators of transition from the adolescent to adult HIV care among youth living with HIV in Moshi, Tanzania. Her mentor was Dorothy Dow. Andrew McCrary. Andrew studied the prevalence of early cardiac dysfunction in children living with HIV in Western Kenya. His mentor was Jerry Bloomfield. Margaret Murray. Margaret studied the association between e-learning system usage and medical student academic performance at the Kilimanjaro Christian Medical University College in Moshi, Tanzania. Her mentor was John Bartlett. Elizabeth Nadishu. Elizabeth evaluated the quality of antihypertensives in Lagos State, Nigeria. Her mentor was Kevin Schulman. Titus Nagano. Titus examined the feasibility of cardiac rehabilitation in Western Kenya. His mentors were Peter Kusin and Jerry Bloomfield. Carissa Novak. Carissa studied predictors of successful treatment acquisition among HPV-positive women in Western Kenya. Her mentor was Megan Hutchko. Chisholm Waneri. Chisholm studied regional disparities of under 5 mortality in China with a focus on issues and challenges for improving child survival. Her mentor was Shengling Tan. Valerie J. Parker. Valerie studied the barriers, facilitations, and perspectives of reverse innovation in England's National Health Service. Her mentor was Krishna Udayakumar. Charles Pate. Charles explored perceptions of healthcare professionals on delays in care for traumatic brain injury patients at Mulago National Referral Hospital in Kampala, Uganda. His mentor was Mike Hagland. Pooja Patel. Pooja conducted a qualitative study exploring the barriers and facilitators to treatment for alcohol use among fathers in Kenya. Her mentor was Eve Puffer. Sarah Philo. Sarah studied norovirus infections and their association with animal exposure in Sarawak, Malaysia. Her mentor was Greg Gray. Melina Price. Melina completed a comparative analysis of forced migration and family planning among Syrian migrants in Jordan. Her mentor was Dennis Clements. Chrissy Rainier. Chrissy examined the accuracy and acceptability of an oral fluid HIV test in children in Harare, Zimbabwe. Her mentor was Carrie Stewart. Kevin Ramser II. Kevin studied caregiver descriptions of joint activity routines and acceptability for a caregiver-mediated early autism spectrum disorder intervention in South Africa. His mentor was Lauren Franz. Lindy Reynolds. Lindy examined pre-hospital transportation and care of externally caused injuries admitted to Karapitia Hospital in Gal, Sri Lanka. Her mentor was Catherine Staton. Tianchen Chung. Tianchen conducted a study of inpatient antimicrobial use in 5 public hospitals in Sri Lanka. Her mentors were Gayani Tilakaratne and Chris Woods. Alia Valles. Alia evaluated the feasibility of self-sampling using CARE HPV and treatment with cryotherapy in Haiti. Her mentor was David Walmer. Natalie Wickenkamp. Natalie conducted a network analysis to create a model of disease transmission among small mammals in Madagascar. Her mentor was Charlie Nunn. Rulin Zhang. Rulin examined the current status and trends of early childhood nutritional status and dietary intake in China. Her mentor was Mary Story. Danny Zhao. Danny conducted a cross-sectional study to test gender as a moderator of associations between pain and depressive symptoms in advanced cancer patients in Singapore. Her mentors were Eric Finkelstein and Joe Egger. Please join me in congratulating our graduates.